Kailabreece.
American novelist William Styron once said, "Mysteriously and in ways that are totally remote from natural experience, the gray drizzle of horror induced by depression takes on the quality of physical pain." Yes, we all know what he means by that. Sometimes the mere sensation of sadness creates physical ache. Depression is a mental disorder characterized by an all-encompassing low mood, accompanied by low self-esteem and loss of interest or pleasure in normally enjoyable activities. Depression is a disabling condition which adversely affects a person's family, work, or school life, sleeping and eating habits, and overall general health. Depressed people may be preoccupied with or reflect over thoughts and feelings of worthlessness, inappropriate guilt or regret, helplessness, hopelessness, and self-hatred. Other symptoms could include poor concentration and memory, withdrawal from social situations and activities, reduced sex drive, and thoughts of death or suicide. Any way you package it, depression is depressing. Well, how do we battle such forces? The three most commonly indicated treatments for depression are psychotherapy, medication, and electroconvulsive therapy. Let's talk about therapy first. Therapists employ a range of techniques based on experimental relationship building. The therapy is simple: improve the mental health of a patient. Critics of psychotherapy are skeptical of the genuine healing power of a psychotherapeutic relationship. Many resources available to a person experiencing emotional distress, like the friendly support of friends, peers, family members, clergy contacts, personal reading, independent coping, present considerable value, suggesting that psychotherapy is often inappropriate or unneeded. Critics note that humans have been dealing with crises, navigating severe social problems, and finding solutions to life problems long before the advent of psychotherapy. Okay, so what about medication? Well, the effectiveness of medication is certainly in question. The FDA concluded that antidepressants are statistically superior to placebos, but their overall effect is low to moderate. And other medications like opiates and marijuana have proven to be a benefit in severely depressed patients, but their acceptance has been severely hampered by governmental narcotic prohibition efforts. So I think it's safe to say that medication will either be mildly effective or inaccessible. So that brings us to electroconvulsive therapy. Sounds pretty hardcore, and it is. In a nutshell, it's a treatment in which seizures are electrically induced in anesthetized patients for therapeutic effect. It is used as a treatment for severe major depression which has not yet responded to other treatments, as well as the treatment of bipolar disorder, catatonia, schizophrenia, and other extreme cases. My question to my fellow intellectuals is this: what do you think about depression? How real is it? Are we overdiagnosing and misdiagnosing the problem? Can those who suffer from severe depression get better without medication or therapy? Is depression merely a sign of a weak mind? Now, like many of you, I have had my sad days and even my so-called depressive ones, but I would not consider myself a depressed individual. Yet when I was younger, I was given antidepressants. I knew then, like I know now, it was bogus. I'm not saying depression isn't real, but I think its presence is greatly amplified by profiteers. Now, although I do not suffer from the grip of depression, I know some who do, and it is hard to watch. You love them, and you try to help them by giving compliments, support, and encouragement. but it never seems to motivate them enough. They take several pills daily and isolate themselves from the world. They live outside reality and find comfort in their mess. They find security in their sorrow. I do believe depression is real, and those that suffer from its hand are its evidence. However, depression only begets depression. I feel strongly that if a depressed individual can organize their day, exercise regularly, maintain a healthy diet, get adequate sleep, and have someone or something to love, they can silence their depression naturally. A wise person once noted, "Happiness is a choice that requires effort." This is Kailabreece. What do you know?